Okay, this is a book review. Here is the book Mercury Poisoning from Dental Amalgam by Patrick Stortebecker. He's from Sweden. It's an extraordinary book. It's a magnificent book. I got to show you a little bit of backstory for it to make sense. I'm actually wearing this tie in honor of him, the red cover on the book, and in honor of ancient Rome, what it reminded me of. This is a very famous story from ancient Rome, and it is the story of Horatius at the bridge. So what happened was the Etruscans were sort of this enemy group that was trying to take over Rome. They were led by a very successful king named Lars Porsena. And they had started to march on Rome, and the Romans knew they would lose. They weren't ready to fight the Etruscans. And Horatius, who was blind in one eye, was the guard of the gate at this bridge over the Tiber River. And they knew if the Etruscans get across this bridge, it was over. Rome was going to be conquered. It was going to fall. So, realizing the desperate odds, Horatius, charged out to fight the Etruscans and just try to slow them down. He was wounded several times. He actually was then able to dive into the river and swim to safety. Meanwhile, the other Romans had successfully disassembled the bridge. So he saved Rome on that day. The English historian Thomas Babington Macaulay wrote a poem about it. Here's an excerpt from that poem. The painting's by Charles Le Brun. It's a beautiful painting. Okay. He said, "Then out spoke brave Horatius, the captain of the gate. To every man upon this earth his death cometh soon or late. And how can man die better than facing fearful odds for the ashes of his fathers and the temples of his gods, and for the tender mother who dandled him to rest, and for the wife who nurses his baby at her breast?" So basically, what it's teaching people is a society needs men to be heroic if it's going to survive, if it's going to be good. And that goes with this book because this is a heroic book. Man, is it an effort. It's an extraordinary book. Okay, and I just say that there's a continuation of noble men, noble masculinity that preserves civilization. Here is a great book, Thomas Cahill, How the Irish Saved Civilization. This is simply one of the greatest Irish paintings right here, meeting on the turret stairs. I had them connected in the slides. But, these Irish monks copying the ancient books of ancient Greece and ancient Rome and the Bible, and here's the Book of Kells with all the illustrations on the Bible, they preserve the works of civilization. And the non-Christian, Vikings and marauders and raiders and barbarians would come and destroy monastery after monastery, quite often burning down the monastery. But there were enough monasteries and enough copies of the books that civilization survived, what was known from the Greeks and Romans and the Bible and the early Christians. And without that, it wouldn't have. So it's a pretty extraordinary thing. And what I see nowadays, too, what we have mostly is places being run by barbarians destroying everything, and it takes a lot of effort to preserve these things because, if people like me, Jeff Nelson at VegSource, and other people who are trying to do the same thing don't preserve this knowledge, the high-fat phonies and all the other bullshit artists, they'll just sweep it away under a rug and it'll be gone. It'll be disappeared. So it's important to keep the truth alive. And here's another perfect example from the history of dentistry. Dentistry is just like medicine. The great dentists, they're all hated by the establishment and vilified, and the establishment tries to destroy them and discredit them. And it's because money comes from lying to people and selling them stuff. You don't really get that much money from telling people the truth and empowering them. So here's Weston Price, a great genius dentist, traveled all over the world, found people eating traditional diets had good teeth, people eating modern diets with flour and sugar and all this stuff have lousy teeth, cavities, and poor dental arches. But more importantly for our talk today, he also did a lot of research on dentistry. In particular, he put a root canal into his son, a 16-year-old boy, and the child died after that as a complication of the root canal procedure. He had a heart attack. And he's like, well, what the heck happened? He took the root canal tooth out of his dead son and he put it into a rabbit. The rabbit died of a heart attack. He put it into another rabbit, died of a heart attack. Another rabbit died of a heart attack. He did that into 100 rabbits and they all died of a heart attack. So there was obviously something bad going on with that tooth. And the thought is that the bacteria changed from aerobic to anaerobic and they release these very powerful toxins, thiol ethers, and mercaptans, things also like dimethyl sulfide, that can be very toxic to the human body. A lot of people have a good enough immune system to keep them under check, but as they get older and more fragile, it potentially causes real problems. Anyways, he was like the head of dental research in I think the USA and Canada. And once he started publishing all these problems of the root canals, they vilified him, discredited him, tried to take all his funding away, etc. And on his deathbed, when he's just like a couple weeks away from dying, he gave all his research and paperwork to Hal Huggins, the sort of new, younger pioneer of dental research to keep it alive. Here's another guy, George Meinig, who was like the head of the Society of Endodontics, a co-founder, and they specialize in doing root canals. But the more he learned about root canals, the more he realized it was a bogus procedure. You can't sterilize the root canal. The roots themselves are not just a single root. They're more like a plant taproot with a bunch of side branches. You can't effectively sterilize it because all the dentine tubules, and they go all the way up and down the tooth, they're always colonized with bacteria. And you need that normal physiology of the fluid going outward to prevent cavities from forming. Okay, and he just recognized the root canal procedure is bogus. As soon as he did that, he's totally discredited. This is Hal Huggins in his old age, probably the greatest dentist of all time, him and Weston Price. And Weston Price gave his papers to him to carry on. He wrote this magnificent book, The Mystery of MS, Solving the Mystery. And I did like 6 parts of a book report on that. It's an extraordinary book. I got it right here. Solving the Mystery of MS, okay? And I'll show you another book here. All this stuff is going to make sense when I show you the book I'm currently reading. And this guy right here wrote The Garbage Collector, and this is a great book too. This is by Robert Gamal. He's still alive. He's a dentist in Australia. And he was retired now, and it's not really safe for a dentist to publish all this while they're alive because the establishment gives them a lot of crap. They took Huggins' license away for telling the truth. He gets punished. But this is a magnificent book too, The Garbage Collector. You can see these are all the Post-its I put in there. I dog-ear the thing, and I write lots of notes in it. I summarize things in the back of the book. That's what I always do. Then we're going to be ready to get to the centerpiece of our day. Here is this book. Okay, and the reason I went through all that is it's a heroic book. What you sense is this guy's brilliant. He's an MD, PhD researcher from Sweden. He summarized every study you could summarize to show how dental amalgams make people sick. All the different studies calculating the rate of escape of the mercury vapor, what happens with different foods. If you chew the food, of course, that stores up the most mercury vapor. Other things, though, if you eat acidic foods, just citrus fruits, oranges, lemons, grapefruit will cause more amalgam vapor to escape. Of course, the high copper amalgams cause more mercury amalgam to escape. Holding a cell phone to the side of your mouth, more mercury vapor to escape. You subtypes all the different types of chemistries. You've got elemental mercury, just Hg, 0 valence, uncharged. But that's dangerous because he did all the studies showing the veins of the face connect to the brain. They don't have valves on them, bidirectional flow. So whatever position you lay down, right, left, stomach, back, you can drain your brain. But you can also go backwards from your mouth up to your brain. And he came up with the conclusion multiple sclerosis is inflammation rather than primarily demyelination, and even a hint of infection, suggesting that the route was from the teeth. Okay, and I actually think Roy Swank is correct for the majority of patients, but I do think it's a contributing mechanism. And other things can contribute to MS. People with a lot of head trauma have more MS, but it's more common in women, and I think this dental thing is a key component of it. Huggins took out amalgams from over 1,000 patients and had lots of great results from doing it to indicate that it was a significant contributor. You can see all the Post-its I put on here because there were so many good things. If I read a crappy book, you'll see 1, 2, or 3 Post-its. This was one thing after another that was magnificent. He goes through all the retrograde neuronal transport, axonal transport, and all the proof of this. All the earlier pioneers, he summarized all their work in it. And so what I'm basically saying, why does he remind me of Horatius at the bridge? The establishment ignored this guy his whole life. Paper after paper after paper. Solid study. He wrote multiple books. And everything he lays out, it's 100% good logic, okay? And it's sort of like, he's like, okay, go ahead and ignore me, but I'm still going to publish all this stuff anyways because I want the truth to be out there. And, and Hal Huggins loved this guy. Gamal loved this guy too. And I do too. This book is so impressive. You see just this brilliant mind trying to help people, trying to summarize. He went through everything. How it can cause loss of a sense of smell, anosmia from inhaling the mercury, damaging the olfactory nerve in your nose, chronic rhinitis, how you're better off breathing with your mouth than your nose in terms of the mercury vapor that goes through your mouth. It just goes through your lungs into your blood. It's dispersed all over the body and therefore not so concentrated. What you inhale through your nose has a much higher concentration going up to your brain, and that potentially over time can cause cognitive decline, can cause moodiness, can cause other neurologic symptoms. I've seen people with tremors from mercury amalgams, and it can cause Parkinson's disease, multiple sclerosis, optic neuritis, insomnia, irritability, personality change, depression, abnormal shyness. It can cause, increased waking up at night to void. Some people think they got a prostate problem. They really got a mercury problem. It can cause infertility. It can cause kidney failure. It can cause dysfunction of your red blood cells because it'll displace the oxygen from the hemoglobin. So you can get chronic fatigue from it. It inhibits electron transport in the intermitochondrial membrane. So you can't make ATP. Plus, once you can't run electrons down that intermitochondrial membrane for electron transport, you start dropping electrons into the matrix, getting oxidative stress. There was just one thing after another that was beautiful. Here's some of the pictures showing retrograde neuronal transport, and that's why you can get trigeminal neuralgia from it. And how much better is it to treat it by removing the tooth rather than doing brain surgery on these people, putting a gel pledget next to their trigeminal nerve and their intracranial vertebral artery branches. Okay, here's him doing a venogram showing that when you inject contrast, this is like a lateral view of the skull on a venogram. When you inject contrast into the jaw, you opacify the veins of the brain. And there's a lot of preliminary work. He went through every single thing, all these studies where they, had mercury amalgams put into sheep, put into monkeys, into other animals, and into rodents, and then they would check up where it would go in their body. And they tracked all this stuff down, and despite proving it, 1,000 times over that the mercury's going all over the place causing problems, the establishment still denies it and tries to pretend that's not the case. And that's because there's, billions of dollars to be made by selling this stuff, and there's also a lot of liability if the public knew what was really going on. The public would be pissed off, but the public is so ignorant. Most people kind of go through life like a dumb animal. They're functional illiterates, so they have no idea what's going on. They're sort of in a drunken stupor, just living from day to day to feed themselves. So there's very, very few people who are educated about what's the truth in health and what's really going on. And I can assure you, 99% of doctors and dentists, they don't know any of this stuff. Okay, I got a lot of doctor friends. I got a lot of doctor friends that are the smartest ones, the top 10% of their class and all that stuff. And I can tell you this, most of them don't know any of this stuff either. It's kind of amazing to me. I'm always reading all the time, but most people don't. But on the other hand, I sort of set up my life so that even though I work full time, in the time that I have off, I really read a lot and do a lot of stuff. Okay. So anyways, yeah, like with my girlfriend, she's like, what's it going to be like to date you? I go, well, you're going to cook for me. You're going to do my laundry. You're going to do all my stuff. Otherwise, you're not going out with me. Anyways, we're not going to go into all that today, but this is a magnificent book. If you are at all interested in dental amalgam, mercury, pathophysiology, the relationship between the mouth and the brain, it's an extraordinary book. It's a magnificent book. This guy's brilliant, and he took his whole life's work. This is like over 50 years of detailed, intelligent summary and connection of all the research. And the bottom line is mercury is a major neurotoxin. It should never be placed in people's mouth. If you have a chance, don't let anybody in your family or friends ever get this stuff put in their mouth because it's a lifelong problem after that. And he also says, well, how come more people, tons of people have mercury? How come people aren't more symptomatic? He says a lot of them have what he would call mercurialism, meaning that they probably do have symptoms that are just not recognized. They're not attributed to the mercury. Moodiness, irritability, impulsive behavior, angry outbursts, gradual cognitive decline. He says a lot of this stuff, depression, anxiety, insomnia, nighttime awakening to void, all these things he says are due to mercury toxicity. They're just not aware of it, as well as dwindling kidney function. So it's a brilliant book, and what do you do? See, now that you know all this stuff, what do you do? I would say, if you're concerned about your mercury amalgams, I would just take them out. I would take the tooth out. And you say, well, what do you replace them with? That's the big question. And I think I would just take the tooth out, replace it with nothing. Because all the different dental materials for replacing it, they're all bad. And you don't want two different types of metal in your mouth because it causes more electrical conduction. We'll talk about that in a separate lecture, but like you never want gold and mercury in your mouth at the same time because they cause tremendous currents and more mercury vapor escaping much more rapidly. So anyways, that's the book. And also, just to say one more thing about books, who writes the best books? The best books are typically written by old guys. You know, once in a while it'll be a woman, but the vast majority are old guys who are close to retirement or retired, and they just want to share what they learned the last, 30, 40, 50 years, and they've been ignored most of their careers, most of them. And again, it goes like to the Colonel John Boyd statement. You can either have a big name or you can do something good. If you want to get a big name, you have to kiss some corporation's ass and lie and get money from them to work within the establishment. But if you want to really help people and do something you're proud of, you're going to have to accept being ostracized and harassed by the establishment or even discredited or fired to be allowed to tell the truth. Because the public just doesn't understand. The medical system hates your guts. It hates your guts. It's based on atheistic Darwinism. It considers you a bunch of talking monkeys who have no right to anything, and you can just shut up and give the establishment your money. Okay, they don't want to help you. They don't care about you. They don't have Christian ethics, okay? They have atheistic Darwinism ethics. So the truth is a fragile thing, but you can learn it if you read and study and want to learn, but it takes effort. But there's a big reward too. Once you learn this stuff, you become a minimalist. And that's the best path to health. Be like Adam and Eve, but keep your indoor heating and plumbing. Try to avoid putting metal into your body. Try to avoid taking medications if you can fix the problem in another way. All right, well anyways, hope you found that helpful.